Hi, I'm Dr. Lisa Merritt, Executive Director of the Multicultural Health Institute. I have been asked, can you answer a few questions about COVID 19? So, here we go. Question number one: is it dangerous to go outside? Well, there's probably more danger getting hit by a car or struck by lightning than to just go outside. The risk is if people are within 6 feet of other people and possibly exposed to droplet contamination, or if they touch common surfaces that other people with possible infections might have touched and then touch their face, possibly inoculating themselves with the virus in the process. In fact, if a person is ill, going outside in a neutral area not close to others may actually be beneficial. It also keeps the air in the home clearer, and it's part of a fresh air effect that we know of historically that was taken advantage of in things like sanatoriums back in the day for treating TB. Going outside is good. Just remember, whatever you do, and when you come back in, wash your hands and don't touch your face. Question number two: a friend is shipping a homemade mask. Can it protect from the virus? Well, the real question is, what is the point of wearing a mask? Masks are currently desperately needed for frontline healthcare workers and will have a higher frequency of exposure to droplets of possibly contaminated body secretions from sick patients. People who are talking, coughing, or wheezing and may spread droplets, that's why you need a mask to stop that transmission, either from someone who's infected or someone who's taking care of someone who might be infected. Just going outside, keeping a 6 foot distance from one another, you're outside of the range in which those droplets usually going to fall. So you really don't need a mask. Question number three: we're getting mixed messages. What is your go-to source for the most updated news about the virus? Well, there are a lot of sources of information, some of them good, some of them not so good, and some of them outright wrong. So please check your sources of information. There are a number of official websites, from coronavirus.jhu.edu, the Johns Hopkins website, which is my personal favorite. Of course, there's cdc.gov. They have a whole special section devoted to coronavirus at the Centers for Disease Control. The National Medical Association, which is at www.nmanet.org, has great information about minority populations and physicians. Of course, our very own Multicultural Health Institute Facebook and website, www.v-mhi.org, also contains up-to-date information. The World Health Organization and a number of other official medical-oriented organizations have a variety of sources of information that you can easily find and locate. Most importantly, wherever you are in your particular area, your local county health department and state health department has up-to-date information relative to your particular region. Question number four: can I still take my children to the playground? Can they attend Little League football practice and things like that? Definitely not right now. There was a real misperception that younger people somehow were immune to the virus. We're happy to say that children in general are doing very well in warding off the virus and not getting very sick, but they are still susceptible. And children playing with other children, touching one another, touching playground equipment, if they have any kind of illness, another child could pick it up. And there are some children with asthma or immunocompromised or cancer, and there are a lot of children now with adult onset diabetes, all of which reduces their ability to ward off infection and increases their susceptibility to infection. So at the end of the day, let's just remember our big things. Number one, wash your hands, wash your hands, wash your hands. That's your best way to prevent transmission of any type of infection. And that's for 20 seconds. You can sing the happy birthday song, the ABC song, whatever you like, but wash thoroughly, wash under your nails. Soap and water is perfect. If you don't have access to that, hand sanitizer is your next bet. Keep social distance. Keep that 6 foot distance away. Cover your cough and your sneeze in your elbow. Try to stay away or stay in if you're coughing and sneezing. If you have to go out, that's when you might need to wear a mask. Okay? Get your rest, eat your vegetables, and just keep a positive mental attitude. This too shall pass. We have been through many things in the past, and there will be more things to come. We just have to keep our wits about us and be grateful for the opportunity to spend more time with our family, to study and learn about things we may not have known before, and to just be better and wiser as a result of this experience.